If you love back pain and you want to be in pain as long as possible, then I'm about to tell you 3 of the most common mistakes that you can make right now to guarantee that you increase your pain and suffering related to back pain. My name is Dr. Grant Elliott, founder of RehabFix, and we have helped thousands of people around the world fully recover from low back pain, disc herniation, and sciatica. And in this episode, number 153 of the Low Back Pain Podcast, I'm going to share with you the most common mistakes that we hear individuals around the world make that simply results in more pain, more time with pain, and decreases your chances of recovering. And I'm going to teach you how to not make those mistakes right now. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. Mistake number 1, immediately rushing to your general provider for imaging to see what the problem is. This is a terrible idea, and it will guarantee that if you want to stay in pain, this is the first thing that you should do. And I'm going to explain why, because this education is so crucial. 90% of acute bouts of lower back pain are called non-specific, meaning that they arise from typical joint, muscle, and disc related injuries. Now, with these types of injuries, there is a very positive natural course of history with them, meaning that many times just natural healing can improve a lot of these scenarios because your body is able to heal. It's the panic that comes with experiencing back pain and rushing to the wrong places that can make it much, much worse. And this is why.
Listen up, listen up, listen up.
What immediately rushing to the general practitioner or to the MRIs or their x-rays does is it guarantees you that you will get a fast track to invasive procedures and a fast track to being exposed to extremely harmful narratives regarding very normal spinal anatomy. So for most of us, if we went and got an x-ray or an MRI right now, even if you're listening to this and you have absolutely no pain, guarantee you they find things on your MRI and they're going to write it down, type it into a report, and it's going to sound really scary. They're going to talk about arthritis. They're going to talk about disc bulges. They're going to talk about stenosis. They're going to talk about, inflammation. They're going to find all these things that they're going to be able to freak you out about, and it's immediately going to increase your sensitivity to pain. It's going to set off all these alarm bells in your brain. It's going to make you freaked out for your situation. And it provides the platform for then a general provider that is not trained in these areas, because that's just the reality. Any good general provider will admit this, that they are not trained in back pain. And even most of the providers that are trained in back pain, like chiropractors and physical therapists, most of the time, they don't even provide the appropriate evidence-based advice. But that's another discussion. But if they get these findings, then they're immediately going to go, hey, we have all these findings. This is the reason for your back pain. It's right here. We can see it. And the only way to fix these is XYZ based on this imaging report. And the next thing you know, you're getting pushed to medications. You're getting pushed to injections. And if those don't work, well, now you're getting pushed to surgery. It happens that fast. And we see this happen all the time. So you might be thinking, okay, well, if you're telling me I shouldn't rush to imaging to try to find out what the problem is or see the problem, then how do I know whether I need imaging or not? Well, here's why. I'll tell you. The only indication for imaging in an acute, stage of low back pain is red flags or trauma. So here are red flags. If you hurt your back, okay, and over the next couple days, you're experiencing rapid progressive neurological deficits, then you should probably go get an MRI. What are rapidly, progressive neurological or motor deficits? That's like maybe you start to feel some numbness in your toe, and now all your toes are numb, and now your whole foot's numb, and now your whole lower leg is numb. This numbness is rapidly consuming your leg very quickly. Okay, that's rapid neurological deficits or lack of sensation. Motor deficits, your foot's getting weak, your toes are weak, now your foot's weak, now your whole lower leg is weak, you're dragging your foot on the ground. If you're progressing to this very quickly, then you should probably go get an MRI. Also, if you're feeling any numbness in your groin region, if you have saddle paresthesia, if you have rapidly progressive symptoms down both legs, this could describe a cauda equina like situation. This is an emergency, okay? Losing bowel or bladder function. You should probably go to the ER or get an MRI. And then lastly, trauma. Trauma, if you just came from an extreme car wreck or a fall, if you're on a ladder and you fell off your roof onto the ground or onto the pavement and you've had bad back pain since, then yeah, you'd probably want to get some imaging to rule out a fracture. These are scenarios where it would be obvious where we should pursue imaging. But for the vast majority of you, 90% or more, that is not the case. It's typically, hey, you know what? I was lifting wrong in the gym, felt a little bit of pain, some soreness, and that's what I'm experiencing. Or, hey, I woke up one morning, I just woke up with back pain. We know that there's been no traumatic incident and your chances of needing imaging are very, very low. The other problem with immediately rushing to imaging is that it ties you to that diagnosis. Whatever that report says, you now have attached yourself to. Oh, it says I have arthritis. That means I have to fix the arthritis in order to get out of pain. Not true. Oh, it shows that I have a disc bulge, so I have to fix this disc bulge. The disc bulge has to be gone off the MRI in order for me to be out of pain. Not true. Oh, I see stenosis. It says that my the holes that my nerves and my spinal cord go through are narrow. I have to get those bigger on this image in order to be out of pain. Not true.
It's not true. It's not true.
None of these things are true. Yes, sometimes there might be something seen on MRI that, once reduced or improved, that pain can be reduced. But attaching yourself to those findings is a very, very dangerous thing and is a guarantee to massively prolong the journey of recovery. Because once again, if you see something, let's say it's a very normal finding, once again, pretty much anybody that gets any imaging on their back above the age of 30 or 40 is going to have disc bulges, arthritis, all these things. Very, very common. So if you are notified of something that is actually not causing your pain, right? Asymptomatic findings, and you attach yourself to that, then you will only get better in your mind, right? Your mind controls everything. You will only get better once you see that that is gone from the image. But the reality is that that image finding could have been there for years and years and years, and it will continue to be there for the rest of your life, not causing any problems. But because you were provided the wrong narrative about your imaging, now you're attached to it, and now you can't let it go. And now unless someone shows you on an image that that's gone or tells you that they're going to do some special treatment for that one thing, you're going to be stuck in a pain cycle.
Over and over.
All of this perpetuates pain, turns to chronic pain, leads to more invasive procedures, and is a bad idea. So that's why the number one thing that you will do wrong is by, hey, I just hurt my back. I'm going to run to the general practitioner. I'm going to run to imaging. I'm going to run to special tests. Bad idea. Hey, real quick, if you're watching this video and you're resonating with the things that I'm saying and you're ready to be pain-free, just click the link below and you can schedule a call personally with my team so we can meet with you, go over your current situation and figure out what you're missing and help you develop a game plan so that you can finally become pain-free. This is for serious people only, so click the link if you are ready to go. Back to the show. The second worst mistake you can make with back pain is to rest and avoid all movement. Immediately tell yourself, I need to avoid all things. I need to avoid stresses on my back. I should not move. I should just freeze and turn into a robot. That is a terrible idea.
I think that idea sucks.
All the current best evidence shows that rest makes back pain worse. Why? Because motion is lotion. Movement is medicine. Your body needs movement to recover from common neuromusculoskeletal disorders. And resting muscles, resting joints, resting tissues is not good for them. It deconditions them. It makes you weaker. It makes you less mobile. The less you move, the more stiff you become, right? The less mobile you are, the less mobile you are.
Well, duh.
And then all of a sudden you have more stiffness, more tightness. Now you perceive more pain on top of that injury. And then you're further afraid to move. So then you move less and then become more tight and then more pain. So then you move less, you become more tight and more pain. And it turns into this cycle as well. This also rewires the brain to believe that certain movements or certain activities will cause you pain. So when you attempt to return to them in the future, it can set off pain signals and alarm signals to trick you into thinking that it is a bad thing. So if immediately after you hurt your back, if you're telling yourself, oh, if I bend over to pick my phone off the ground, or if I, bend over to do these dishes, I'm going to hurt my back. I should not do this. Your brain is remembering that. And it's already starting to rewire of, hey, you know what? I should not do this in the future. If I go to do this in the future, I'm going to create pain to try to protect you. So you immediately start rewiring your nervous system to gain fear avoidance behaviors and pain signaling movements to initially attempt to protect you. That's the goal. But with this over anxiousness, this over awareness of your movements and being afraid to move, you are actually creating painful movements as a result. And we do not want to do that. The best thing you can do is to, yes, stay within your comfort zone, move within your limits, but to not avoid movement. Maintain to the best of your ability your normal daily activities. This is well documented to rapidly improve the resolution of back pain. And number 3, relying on passive therapies. If you don't want to get better, if you want to be stuck in pain, rely on passive therapies. Why? Because these are tricks to try to convince you that you don't have to do any work, that you can just lay down on a table and have someone else do the work for you. They'll come in, they'll adjust you, they'll massage you, they'll scrape your muscles, they'll put some needles in there, they'll put some e-stim, some hot packs on your back, and voila, they can take the pain away for you. Not true. That's a lie. Solely relying on passive therapies and being tricked into the mantra of, oh, you need all these different treatments that only we can provide, and this will take away your pain, is a fast track to losing all independence regarding your treatment and relying on other people. If you are fully reliant on someone else, you will not be in control of your body. You will not be in control of your pain. And so the first thing you need to do is identify a route of treatment that empowers you, that puts you in control, that makes you independent. Yes, guidance is there, coaching is there, but movements, rehab exercises to address the key areas, the limitations, the root issue, so that you can learn how to fix yourself and become empowered through the process, not laying there helpless, crossing your fingers that someone else can do it for you and convincing you that they can. That is not true. If a provider wants to include passive therapies into an active approach, if they want to take you through exercises but also improve some passive therapies, that is one scenario that could be okay. All right, you can combine things and try to speed up recovery that way. That's all right. There's nothing wrong with that. But if you're being told to only rely on passive therapies, once again, a passive therapy is anything that somebody else is doing for you that you cannot do on your own, that does not involve movement. That is a passive therapy. If you're being told to solely rely on this, or this is the only thing you should be doing throughout your course of your treatment, that is a great way to stay in pain and to not learn how to fix yourself. So if you want to get out of pain as quickly as possible, do the opposite of these 3 things. Do not run to imaging off the bat and immediately pursue invasive procedures. Do not be convinced that your imaging equals you, that you have to fix whatever is on the image, otherwise you will not be pain-free. Do not rest. Do not avoid all movements. Do not try to avoid daily life activities and be fearful of what you're going to do. Do not rely on passive therapies. Do not allow yourself to be tricked into thinking that someone else can do all the work for you. It is simply not true. You have to put in the work.
You can do it!
If you do the opposite of these 3 things, then you will be successful. And this is why we help people around the world online without touching anybody, because we take people through a proper movement analysis and we determine, hey, all of these passive therapies, they haven't worked for you. All of these approaches, they haven't worked. Let's find your key limitations and your key movements, because you can coach anyone anywhere in the world through movement over video, just like we do. And we take them through these tests and these movements and these exercises and identify what exercises they should be doing, what exercises they should not be doing, and the step-by-step plan as we hold their hand from start to finish to guarantee their success. This is why we do what we do, and this is why we get amazing results with our amazing clients who are fully dedicated towards taking charge of their health once again. So reach out. Don't do it on your own. Don't put that pressure on yourself to try to figure this thing out. Let us do it with you as a team, and let's get this over with, because you only have one life, and life is short, and you don't want to waste any time dealing with pain that you otherwise should not be living with, because you don't have to live with pain, and you can end it right now. You just have to take that step towards asking for help and investing in your health. So let's do it.
Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.